But some areas of the lung, it has only the pulmonary branches supplying it. Okay, it only has pulmonary arteries. So if those arteries are obstructed by embolus, it can cause infarction. Okay, so this is what one. And multiple emboli. If there are many emboli, you can see if there are many emboli in the lungs, in the pulmonary, it can cause pulmonary hypertension. Why? Because the lumen size will decrease because of embolus, and there will be increased pressure in the pulmonary arteries. Because of increased pressure in the pulmonary arteries, there will be increased pressure in the right ventricle. There will be pressure in the right ventricle, and the right heart will fail, and it is called the right ventricular failure. So you should remember that multiple pulmonary emboli, they are silent and small, no problem. But whenever there is a large embolus, which like this, which sits on the pulmonary trunk and obstruct both the pulmonary arteries, it can cause sudden death. If it obstruct the small pulmonary artery branches, which have only one pulmonary branch supplying it, it can cause infarction. And if it is multiple pulmonary emboli, it can cause pulmonary hypertension, which will increase the workload on the right ventricle, and the right ventricle will fail. So these are the clinical features which of the this one. Now we will see systemic thromboembolism. Now see, we have seen what are the venous thromboembolism, the embolus which is arising from the veins. So usually when they arise from the veins, they will go through the inferior vena cava into the right side of the heart, and it will go into the lungs. Okay, from the veins. Now we will see what is the embolus developed from the arteries. So this is called as a systemic thromboembolism. We saw the venous thromboembolism arising from the veins of the legs. Now we will see systemic thromboembolism which are arising from the arteries. So most of the systemic thromboembolism, they arise from the heart. You can see this is the heart, and you can see from sometimes the blood, the thrombus develops in the heart, in the ventricle. You can see in the ventricle or over the valves. You can see these are the valves. Over the valve, the thrombus develop, and from there, that is called as the endocarditis. When you will do cardiovascular system, you will learn this endocarditis where thrombus develops on the valves. So sometimes thrombus develops in the heart and in the valve, and from there the thrombus is dislodged. It breaks, and it will go into the aorta, right? And it will go into the aorta, and it will go into the various organs. Okay, so the most important systemic thromboembolism, it can arise from the heart, from the valve. Also, sometimes, atherosclerosis is there. I told you, the atherosclerosis is a deposition of the fat material inside the wall of the blood vessel. So it can happen in aorta. It can also happen in carotid. So sometimes this atherosclerotic thrombus, it can also break, and it will go into the arteries, to the different arteries. Okay. So, and sometimes, in the embolus can develop also in the iliac arteries. You can see this is the iliac arteries. So what are the sites of systemic thromboembolism? In the heart, in the valves, in the carotid artery, in the aorta, in atherosclerosis, and in the iliac artery. So these are the various sites where the thrombus can develop, and it can lead to embolism. Then what it will do, if I told you, if it is in the veins, it will go into the lungs. Okay, and it will cause pulmonary thromboembolism, hypoxia, or sudden death, hypoxia, or pulmonary hypertension. But when it develops in here in the arteries, it will go into the arteries, and especially it will go from the aorta, it will go to the lower limbs, and it will obstruct it will cause gangrene of the lower limb. It will cause obstruction of the arteries of the lower limbs. It will obstruct the arteries of the lower limbs. That is 75%. Many it will go to the lower limbs. Then secondly, it can also go from the heart. It can go to the brain and obstruct the blood supply to the brain. Okay, it can also go to the various organs like the liver and the kidney, because this embolism, it will go to the kidney and the liver, and it will obstruct the blood supply to the liver. So this is so if it arises from the arteries, it will go to the various organs. But if it arises in the veins, it will go to the lungs. Okay, if it arises from the arteries or from the heart, it will go to the lower extremities. Can go to the brain. It can go to the intestine, spleen, liver. Okay, so these are all the organs it will go in. It can obstruct the blood supply. Now, consequences means it depend upon what will happen to that organ. It will depend upon the caliber of the occluded blood vessel. If the blood vessel is occluded small, it will easily be obstructed, and it will the blood supply to the organ will decrease, and it will cause infarction. Collateral supply, if that organ is having another blood supply, it will not undergo infarction. And tissue vulnerability to anoxia, like some tissue like the brain, the neuron, they are very sensitive to anoxia. Anoxia means less oxygen. If the brain doesn't receive oxygen for 3 or 4 minutes, it can die. So even if for 3 or 4 minutes, if the brain doesn't receive blood supply, the brain tissue will undergo infarction, necrosis. Fat embolism. Now we finish thromboembolism. Okay, fat embolism. Fat embolism means the fat particles that travel in the blood, And when fat will enter the blood, normally the fat doesn't, fat is not present in the blood. Okay, when fat will enter, whenever there is injury. Okay, whenever there is injury, especially to the bones. Okay, to the long bone, like in accidents or trauma, the long bones are broken, and within the long bones, in the long bone there is fat material. So when the long bone is fractured, the fat material from the long bones will be released and it will enter into the circulation. And this happens in skeletal injuries when the bone is fractured. Like here you can see, this is the important diagram. Now see, this is the normal bone. Okay, this is the normal bone, and inside the bone you have fat material. You can see this is the fat which is present inside the bone. And these are the veins and these are the arteries. Okay, you can see this is the fat material and these are the hematopoietic stem cells which are present in the bone, within the bone. This is the bone, outside of the bone. This is the bone, and inside of the bone there is a bone marrow which has this fat material. So what? And this is the arterial and the venous system, the network of arteries, and this is the arterial and the venous system. So what happens? See, now the bone is breaking. Suppose in accident or fracture, the bone is breaking. So what will happen when the bone breaks? This fat material, it will enter the vein. You can see it is entering the blood vessel. So this fat material, it will enter whenever the bone break, the fat material, and when the bone break, the arteries and the veins also break in that region. So what will happen? This fat material, it will go into the veins, and finally it will go to the veins, to the inferior vena cava, and again it will go to the lungs. Okay, and it will cause hypoxia, breathlessness. Understood? So this is called as a fat embolism. Okay, so fat embolism. So you can see this is the microscopy of the lung. These are the lung. These are the alveoli. You can see these are the alveoli, and these are the lung. And in the alveoli, within the alveoli, you are seeing normally in the lung you will not see fat particle, but here you are seeing fat particles in the lung. So you should see that this is a fat embolism. The fat has come from the vein and it has come into the lungs. So this is the fat which is present in the lung, and this is the fat emboli. Amniotic fluid embolism. Okay, now amniotic fluid, amniotic fluid is present in the uterus when the baby is developing. When the woman is pregnant, see, this is the baby, and around the baby there is amniotic fluid. Okay, around the fetus there is the amniotic fluid. Why there is amniotic fluid? To protect the baby. It acts like a shock absorber. The amniotic fluid is there. But during delivery, what happens? During delivery, when the baby is delivered, this amniotic fluid, the maternal blood vessel, the blood vessel of the mother in the placenta, they are broken, they are ruptured. So this amniotic fluid, it can enter into the blood vessels of the mother. Okay, it can enter the blood vessels of the mother, and this amniotic fluid, it can travel from into the veins, to the inferior vena cava, and again it can enter the lungs and cause embolism. So this is very important. Secondly, this amniotic fluid is very dangerous because it also has some chemicals which cause clotting of the blood. So when it enters the blood, it causes a lot of clots in the blood. Because of the various clots, many clots are there in the body, and it is very dangerous. So this is amniotic fluid embolism. It is a complication of labor. Okay, it is a complication of labor means delivery. It is a complication of labor immediate postpartum period. Postpartum means after delivery, it is a complication. And the embolus, I told you, the embolus can enter the blood vessel of the mother. It can go into the vein, and it can go into the lungs. And when it goes into the lung, it can cause dyspnea because there is hypoxia, less oxygen. So it will cause breathlessness, cyanosis. Cyanosis means less oxygen, deoxygenated blood, lot of deoxygenated blood, and hypotension. Okay, and also when it can go to the brain, and it can cause seizures and coma. So this is very important. This is a very dangerous situation. This amniotic fluid embolism, it is very important. It can, I told you when it enters, this amniotic fluid enters into the blood, it can cause lot of clot. Okay, lot of clot in the blood, and it can cause DIC. DIC means disseminated intravascular coagulation. Lot of clotting is there in the blood, and that will lead to patient's death. Okay. So you should remember, so entry of amniotic fluid into the pulmonary circulation, the amniotic fluid which is present in the uterus around the baby, it can enter the maternal circulation, the mother's circulation, when during delivery through the tears which are there in the placenta membrane, and from there the amniotic fluid, it can travel into the lungs, into the pulmonary circulation, and it can cause hypoxia, dyspnea. Okay, but the most important is that it has some chemical which causes coagulation, it causes clotting of the blood. So it causes DIC. DIC means disseminated intravascular coagulation. It causes clotting of the blood in the mother's blood vessel, and it will lead because of some chemical thrombogenic substances which are present in the amniotic fluid. So what will happen, majority of the death is not due to pulmonary embolism. Majority of the death in amniotic fluid embolism is not because the embolism has entered the lungs, but it is due to this coagulation system activation. Lot of clots are formed in the body, in the blood, and these clots, they obstruct various blood vessels and various organs, and they undergo necrosis, failure, and because of this, the death is this because embolism is because of this activation of coagulation system. Lot of clots are formed in the blood. That is the main cause, but the emboli can travel into the pulmonary vessels also. Now air embolism. Okay, now we have finished we have finished amniotic fluid, we have finished air. Now air embolism. Now sometimes gas bubbles also can enter the circulation. Gas bubble. Now I will tell you how the gas bubble will enter the circulation. Okay, and they can also obstruct the blood vessel and can cause systemic ischemic injury. Okay, so how the gas enters the blood vessel? This is called, there is scuba divers who underwater construction workers. When you go inside the water, when we go inside the water, the atmospheric pressure is very high. Okay, so when the atmospheric pressure is very high inside the sea, inside the ocean, large amount of gas, particularly nitrogen. Nitrogen, when you go inside, like scuba divers, or they will go inside the sea, lot of gas, nitrogen, it becomes dissolved in the blood and the tissue. Lot of nitrogen, when they go down into the sea, lot of nitrogen, and they dissolve in it get dissolved in the blood and the tissue. But when they come up, this nitrogen, it expands in the tissues and bubbles come out of the blood. First it dissolves when they go down, it dissolves in the blood, but when they come up, it comes out of the blood and it forms gas bubbles. Okay, it forms gas bubbles and they form gas emboli. So you will see gas emboli in the blood, and these gas emboli, they will travel in the blood and they will obstruct the various blood vessels, and they can cause tissue ischemia. Okay, and necrosis. So gas bubbles, you will see even in the lungs, pulmonary vasculature, which will cause edema, hemorrhages, atelectasis, damage to the brain, emphysema, and it can cause respiratory distress because oxygen will not be there in the lung and there will be respiratory distress. So gas bubbles can travel inside the pulmonary, can enter the pulmonary circulation also. Also the bubbles can travel to the brain. Okay, it can travel to the brain, it can cause a lot of mental impairment and even sudden onset of coma. So this is very dangerous. So this, the gas bubble can also travel to the brain and it can cause coma. Now we have finished the various types of emboli. Okay, so just to revise, we will see what is an embolus. Embolus, it is a mass which is carried in the blood. It can be solid, liquid, or gas. The most common embolism we have seen is the thromboembolism. Thromboembolism arising from the thrombus in the veins. It arises from the deep veins, from the thrombus. The thrombus breaks, embolus, and it goes into the pulmonary circulation, obstruct the pulmonary blood vessels. Then this is a big thrombus which obstruct the pulmonary embolus. It can cause sudden death. Okay, this is the systemic thromboembolism which is arising from the arteries and the heart. From the heart and the arteries, this will travel to the various organs, especially to the lower extremities, obstruct the lower extremities, and also the other organ like the kidney, spleen, intestine, and the liver. So this is the thromboembolism arising from the thrombus, which is the most common cause of embolism. The most common cause of embolism is arising from the thrombus. It breaks from the thrombus, even in the artery and even in the vein. Then the other is the fat embolism. Fat enters the blood. It is from the fracture of the bones. The bone is fractured and the fat from the bone marrow, it enters into the circulation. Again, it will travel into the lungs and it will cause hypoxia. Okay, so you can see the fat inside the lungs. Then the third is the amniotic fluid. Amniotic fluid is present around the baby. When the baby is delivered, the amniotic fluid can enter the blood and it can go into the veins and it will go again into the lung. But the most important is that the amniotic fluid has some chemical which causes clotting of the blood. So it causes a lot of clotting of the blood and it causes damage to the various organs of the brain. And finally, you have the gas embolus or the air embolism, especially in scuba divers. When they go down, when they go down into the sea, the oxygen get dissolved, and when they come up, the oxygen rapidly comes out of the blood and it forms bubbles in the blood. And these bubbles can cause tissue, obstruct the blood vessel. They can cause ischemia and infarction. They can also go to the pulmonary circulation, the gas bubbles, and can cause hypoxia, less oxygen, and also these bubbles can go into the brain and they can cause coma. Now, infarction. What is infarction? Infarction, whenever some tissue is obstructed, whenever some tissue or organ is obstructed by vascular supply is cut off, the blood supply is not the tissue is not receiving the blood supply, it will undergo necrosis. That is called the ischemic necrosis. The blood supply is not there to the tissue, it will undergo necrosis, ischemic necrosis, and that is called as the infarction. So infarction is basically necrosis. So you can see the many important organs, they can undergo infarction when they do not receive the blood supply. You will learn when you will go to the hospital, you will learn first is the myocardial, that is the heart, the cerebral infarction, brain infarction, myocardial infarction, even pulmonary infarction, okay, and even the small intestine infarction, and also ischemic infarction, ischemic necrosis of distal extremities. When the extremities, the blood supply to the lower extremities, they are blocked, it can cause ischemic necrosis. What is called? It is called gangrene. You have just finished the PBL, right? The PBL gangrene. So gangrene is also a type of necrosis due to obstruction of the blood supply to the extremities, to the legs. So there are infarction is the ischemic necrosis to the various organs, heart, brain, lungs, and also to the lower limbs. Okay. So what is the main cause? I told you the main cause is thrombosis, either thrombosis or embolism. These thrombosis or embolism, they will decrease the blood supply to the organ and they will cause infarction. Okay. The most of the, I told you in necrosis, the most of the necrosis is coagulative necrosis. Like in many solid organs like liver, spleen, kidney, it will undergo coagulative necrosis. But the brain is an exception. Brain will undergo liquefactive necrosis. So the brain will undergo liquefactive necrosis. So classification of necrosis depends upon the color of the infarct. It can be red, or when blood is there in the infarct, it is called as the hemorrhagic infarct. When it is white in color, it is called as the white infarct. Depending upon whether infection is present or no, it is called a septic infarct. When the infection is present, it is called as a septic infarct. When the infection is absent, it is called as the bland infarct. The most important classification is this one: red infarct and white infarct. Okay, so what is a red infarct? Red infarct, it means when that area has been undergone necrosis, but the color is red. Okay, that area, that tissue has been damaged, that tissue has undergone necrosis, but the color of that infarct is red. Why red? Because in those cases there is congestion. I told you what is congestion. Congestion means whenever the venous blood is there in the tissue, so the tissue is not receiving oxygen because a lot of venous blood is only there. Okay, there is no oxygenated blood. So when the tissues are congested, it is receiving only deoxygenated blood. It is not receiving oxygenated blood. So in that case, the infarct will be, the tissue will die, but the color will be red because there is congestion. There is collection of deoxygenated blood. Also in tissues where there is dual circulation, like the lungs and the intestine, even if one artery is damaged, it will have another artery which is supplying the blood. So in that case, the color of the infarct will be red. Okay, and also in venous occlusion, when there is congestion, there is congestion. In that case, the color of the infarct will be red, like the ovaries and the testes. So you should remember the red infarct, red infarct, whenever there is congestion or whenever there is dual circulation, two blood supply to the organ, the color of the infarct will be red in color. Okay, like in case of venous occlusion, when there is congestion, ovaries and testes, or where there is a dual circulation, like the lungs and the intestine, where even if the lung is one artery is blocked, the other artery will supply the blood. So in that cases, the color of the infarct will be red in color, and also after infarction occurred. Okay. Now see, this is the picture. You can see this is the lung, and see this area has been undergone necrosis. This is the lung, and this area is red in color, reddish brownish in color. So this is the red infarct. Okay, and here this is the artery. You can see this. This is the testes. This is the testes, and there is a lot of congestion in the testes because of venous obstruction. There is a lot of congestion in the testes. The testes have undergone necrosis, but the color is red. So this is the red infarct. Then white infarct. White infarct occurs whenever there is an arterial circulation, when only one blood supply, only one artery is supplying the organ. Then in that case, there is that artery is obstructed, so it will be the white infarct. So that area will become white in color because only that artery is supplying. So no blood supply to that organ, and that area will undergo necrosis and it will be whitish in color, like the heart, the spleen, and the kidney. They have only one blood supply. They do not have two blood supply like the lungs. So they will have only one artery supplying it. If that artery is blocked, it will undergo necrosis, and it will undergo white infarct. It will appear whitish in color. So here you can see this is the white infarct. You can see this is the kidney, and you can see this triangular area. See, this is the kidney, and this is the area which is affected. So if this artery is blocked, this area will be damaged. It will not get any blood supply. It will the cells here will die. It will undergo coagulative necrosis, and this area will appear whitish in color. So you can see this triangular area whitish in color. This is the kidney. So this is the white infarct. You can see white infarct. And the apex is here is the artery. The apex is the artery. The occluded vessel is here. So here is the artery, apex at the artery and the base. So this is the triangular area, the infarcted area. This is a white infarct. Here. Now, what are the factors that important in developing of infarction? What are the important factors? First is the anatomy of the vascular supply. You know, the organs which have two blood supply, like the lungs or the intestine, they have two blood supply. So those who have two blood supply, they are less likely to undergo infarction, because even if one is blocked, they will receive blood supply from the other artery. So anatomy of the vascular supply. If there is an alternative blood supply, that organ will it is safe. It will not undergo infarction so easily. Then rate of occlusion. Okay, but if any organ is having only one blood supply, it can easily undergo infarction, because if that artery is blocked, it can undergo infarction. Then rate of occlusion. If the occlusion is developing slowly, you know, it is not developing suddenly, it is developing slowly. So what will happen? It will give time so that the other blood supply, other arteries will open up around the blood, around that tissue. So if it is slowly developing occlusion, the collateral blood supply will develop and the organ will not suffer infarction. Like, you know, when the highway is blocked, you know, so when the cars will go through the small roads, so that is the collateral. Okay, so whenever the rate of occlusion, that is the slowly developing occlusion, the other collateral around the blood vessel will develop around the tissue and around the organ, and that area will not undergo infarction. And tissue vulnerability to hypoxia. Some tissues, they are very sensitive, you know, even if they don't receive blood supply or oxygen for little time, they will undergo infarction. Like neurons, brain. If in the brain, even for 3 or 4 minutes, if the brain doesn't receive oxygen or blood supply, it can be damaged and it can go undergo necrosis. That's why the neurons are very important. Similarly, the myocardial cell, the heart cell, if they don't receive blood supply for 20 to 30 minutes, they will die and there will be myocardial necrosis. Whereas, you know, skeletal muscles or either they can sustain hypoxia or less blood supply for maybe many hours. Okay, but you know, some cells, they are very sensitive. If they do not receive oxygen or blood supply for 3 to 4 minutes, the neurons will die. If heart cell will die if they do not receive blood supply for 20 to 30 minutes. So these are the factors that influence infarct formation. If the organ is having two blood supply, it is better. It will not develop infarction. If the rate of occlusion is slow, it will not develop infarction. And if some cells like neurons and myocardial, they are very sensitive to hypoxia. If they do not receive blood supply for less time, for even a few minutes, they can die. So these are the this thing. Okay, let me take your attendance. Okay, don't go. But what is any questions? If you have, you can ask me. Any questions? Any question?
Thank you.
Don't go. Let me take the attendance. Yes. Anything? Any questions you have? Yes. Anyone you want to ask me something? All of you understood or no?
Yes, thank you.
Huh? Okay. If you have any question, you can ask me. Okay. So I will end the meeting. Okay.
Thank
Should
you.
I end the meeting? Yeah. Any question? Okay, I will end the meeting. Thank you. Assalamu alaikum. Okay, Dawadmi students, I am sending you the link for the lab. At 3 o'clock there is lab. Okay, so for Dawadmi students, I will send the link for the lab at 3 o'clock.